Good morning, good afternoon, good evening. Hello, everyone around the world and anyone listening who is interested. My name is Karlos Reyes. I am a community health worker in lead poison prevention. And as we got to know each other in the first episode, this podcast is really about sharing information and really getting as much information out to landlords as well as tenants in regards to lead poison prevention. And so on October 24th through the 30th, it is Lead Poison Prevention Week. And so it's a pleasure to create content for people, not only in Massachusetts area, but anyone who is listening who is intrigued or interested or who is affected by lead poison prevention. On this particular episode, we are going to discuss de-leading, finances, and how people, what resources are available out there, especially to people particularly in Massachusetts, where we are recording from and where we are based out of. So the goal is, once again, to share information and just create a conversation around lead poison prevention, which is still a relevant topic in 2021, going into 2022 and forward. So with that said, I have two incredible co-hosts here with me, Miss Kimberly and Mr. Nigel, and I will let them introduce themselves. Nigel, take it away.
Good morning, man. Thanks for making this space here. Really appreciate every opportunity I get to share information about the work that I do, and some of the priorities that the city of Springfield has related to lead poisoning prevention. So Nigel Greaves is my name. I am a senior project manager, project director for the Office of Housing with the city of Springfield. And just for even clarity, that's basically City Hall, because we do get some level of confusion with the Springfield Housing Authority sometimes. So this is City Hall. This is city government here speaking, and we are really invested in trying to make sure that kids don't get sick by lead paint in their houses. And we got money to share to help make that much less of a frequent occurrence. So that's awesome. The biggest part of my role here, and happy to share more information as much as I can.
And you guys can't see, but he has a really cool green polo on, and I'm actually a little bit jealous about it. All right, and then we also
it's very comfortable. Very comfortable.
Very fashion forward this morning, young man. I also want to introduce our colleague Kimberly. Kimberly, I don't know how to pronounce your last name, and I don't want to ruin it. Could you say it?
Oh, my last name is pronounced Ma and A. So literally how it looks like.
Gotcha.
Ma and A. So my name is Kimberly. I am the project coordinator at the Public Health Institute. I'm still relatively new in my position, but I'm learning a little bit more and more about lead prevention, lead poisoning, the Springfield Healthy Homes Project, which I will be providing education, promotion, and outreach for. And I'm just really interested in what everyone has to say.
Thank you so much. And I just want to say that, thank you so much for your time. I think this is a great way to start a Monday morning, in my eyes. And I'm sure that everyone in Western Massachusetts and in Massachusetts in general listening, hopefully, will find this information very useful and also will share the information, because sharing is caring in my world, right? And knowledge is power. So with that said, I want to talk about de-leading and just what resources are out there. And I guess, Nigel, maybe I can pose this first question to you and ask you, why is the city so concerned around lead poison?
Well, it's a sneaky kind of a problem, right? It's a sneaky problem that can have major ramifications for public health. So the biggest issue with lead poisoning is as it relates to young people, if they're ingesting or in any way taking lead into their bodies. The lead is a metal, and when it gets into your body, it starts to affect the way your bones grow. It starts to affect the way your brain grows. And if this is happening with young children, we know that those early years are the most important to really defining how a person is going to grow into their adulthood and into their lives. So if you've got this foreign substance that's occupying space in a young person's body, it's really going to affect the way they grow. And so that is going to affect their academic performance. It's going to affect their physical abilities. And, we've seen evidence of those types of problems here in Springfield. Some years ago, it was at a pretty high level, and we were able to identify that together with some of our public health partners, and decided that we wanted to apply for some funding. The federal government recognizes that this is an issue, where even at a time when some federal programs were being cut, and maybe some conservative fiscal policies were taking hold, lead paint prevention remained a priority for our federal government. So they made funds available to cities and states to apply for, and try to see what you can do on a local level to try to prevent this lead poisoning issue from really becoming a big thing. So Springfield applied. We actually had some funding for lead paint abatement many years ago. That funding ran out for whatever reason. Prior to my tenure, we had not reapplied, or we did not get that funding renewed for whatever reason. And then it was renewed as a part of a larger grant for healthy homes when I was first hired in this role. And then subsequently another grant, a secondary grant, primarily for lead paint abatement. So it becomes a major part of our housing rehab program funding that we have available out of our office. And
right.
We're trying to push to get as many homes abated for lead as we can to try to eliminate this as a problem amongst our youth.
Perfect. Thank you so much for answering that. I have another question for you. What resources does the city of Springfield have for families with young children?
So, primarily we have money. We have money available.
Okay.
So in order to, and so when I say primarily, the other resources we have available are our partnerships with organizations like yours, right? So Square One makes you available to families that have had lead poisoning issues in their home.
Right.
And so you work directly with those families and those children to try to get them on a right path to, just do whatever you can to lessen the effects of that problem once it emerges. Right. We have partners that are helping with research. Bay State Hospital obviously is working on the medical aspect of these poison cases.
Right.
And so what the city provides is a support network for some of that work to happen, but primarily we have money for homeowners to get their homes fixed, to borrow a phrase, and we'll come back to this phrase later on, but to borrow a phrase, to get the lead out, to make those homes lead safe for young people to just kind of be around. You got babies. I have a 4-year-old and a 1-year-old, right?
Sure. Yeah.
And anybody, my kids are special to me, but they're not special in this sense. Kids like to put stuff in their mouths. They like to pick up stuff off the floor and put it in their mouths. And my kids are not special in that way. And so I've seen that happen around my place. And if it's happening in a home where we know that there are lead paint hazards present, those kids can get sick, and it would be a really terrible thing if that happened. So, so the city has funding. The city has grant funding available for homeowners who live in their house, a single-family home where the homeowner lives in the house. That homeowner can get a grant, and I specify a grant. Some of the other funding we have available comes in the form of a loan, a mortgage, a lien is put in your home. There's a couple more steps to the process. But if you're a homeowner living in your home and you have a single family house, you get a grant. Makes it very simple. Free money. Free money comes your way. The city also helps to find a contractor to take care of this work, because what it amounts to is a home rehab. But it's so specified and so regulated, and so particular as to where the lead paint is, what kind of a hazard it is, and how you take care of it, It's a highly regulated type of work. So the contractors who do this work have to have special credentials. They have to be licensed lead paint abatement contractors. And so anyways, to find these types of contractors, to identify who's licensed, insured, make sure that they can take on a job such as the one that might be necessary at somebody's home, the city helps out with that process. It's hard to get a contractor sometimes, somebody you trust, somebody who can do a good job. So the city helps.
Yeah.
And then, like I mentioned, if you're not in a single family home, if you're not the homeowner who lives there, if you're in just another type of building, if you're a renter, and you think that there are dangers around lead paint in your house, there are still funds available. It just becomes, you got a couple more steps to the process, but those funds are available in the form of a mortgage. We put a lien on the home just to be sure that because it then becomes an investment property, and if it's an investment for that homeowner, then they have a financial stake in it. They can make money off of it at some point, and so the city says, well, we want to be, we want to have a figure in there too, but it's still free money from the standpoint that the loan is a zero interest loan. There are no payments due along the way, and after 3 years, that loan is free. And so you don't ever have to pay anything back if you live in the house. If you're truly an investment owner, if you actually don't live in the house at all, if it's a fully rented property, if it's 2 units, 3 units, or whatever it may be, but the owner of the home lives elsewhere,
right?
Then there would be a little bit that would be owed back. Still zero interest, still no payments throughout the life of the loan, or the loan term is 3 years, where you have to have income qualified families living there. If you ever sold a home as an investment owner, if you are a landlord, if you ever sold a home, you would have to pay back 25%.
25% of the loan.
The cost of the work that was done.
Got it.
And that's still a pretty good deal.
Yeah.
I see projects that are $60,000. Could be hard to come up with $15,000 or $20,000 out of pocket.
Right.
You had to pay for it. You had to pay for a portion. So anyway, funds available, and we're trying to get as many people knowledgeable about that availability as possible.
Thank you so much for answering that. So it's 25% of the work that was done, of the cost of the work that was done, if they sell it. Awesome. And so, go ahead. My apologies.
And I was just saying that's the only case in which funds would be exchanged.
Okay.
Is an investment owner who lives elsewhere.
So with all that information, with all that said, how does one sign up? How does one, reach out for these resources? Where can they find it? What do they do?
Come on down. That's tested on the Price is Right.
That's exactly what went in my head when you said that. Yes.
So, and the price would be right? I think the price would be right. So when I say come on down, we're located right downtown City Hall, in the middle of the city of Springfield.
Yeah.
We're actually not in City Hall. I may have said we're in City Hall. We are City Hall, like quote unquote, but our building is an annex building, so we're sort of across the street from City Hall.
Gotcha.
There's a lot of us, so we needed extra space. So we're in the annex building on East Columbus Avenue, 1600 East Columbus Avenue. You feel free to come on down to our office. That gives you the chance to have a conversation with one of our staff members,
right?
Either myself, my intake coordinator, Mariceli Vega, our rehab supervisor, deputy directors, Bobby Tabusis. One of us have a conversation with you about all the steps that are part of the process. We can talk in person. COVID restrictions have lifted at this point, so that our offices are open, and we can have a little conversation about how it might go at your home, because every house is different. What I've learned in my work, every job, every project, every house, every family is different, and so a conversation is always warranted to find out what's our starting point. Although I should say the starting point almost always is a lead inspection.
Absolutely.
Want to inspect the home to find out, where is the lead? Is there lead? Where is it? And how bad is it? And so that's often the first step. And then, steps vary from there. So we have a conversation about it. If you can't make it down to the office, obviously call. 413 787 6500, 413 787 6500. And we can talk over the phone. We're certainly capable of exchanging most documents, not all, but most documents by email. And so you can do that. You can certainly find information on the website at springfieldcityhall.com. You can go to the housing tab, housing and community development tab, or search for housing, search for lead abatement, and search, and you'll get the options related to our program right up top.
Perfect. And just one quick question that I just wanted to end this with is, given the pandemic and given COVID and everything, how much of an influx, I guess would be the word, or how much of an increase in people applying for this lately have you seen, and what have you, just the need for it right now?
Well, it goes up and down. As far as our application intake, it's hard to pinpoint how many or how often applications will come in, and kind of the frequency of that. We certainly do some advertising pushes at different times, trying to get the word out. We've gotten some news attention. We've gotten some media attention, where we've been featured on News 22. We've had a article on Mass Live. The Reminder also has published some information about the fact that these funds are available. So when those news clips come out, we get a little bit of an influx of applications. We had a piece on Telemundo that hit a couple weeks ago. We got some calls after that. Yes, indeed. And so we had an influx of applications after that happened. So I saw you raise your hand off Telemundo. We do want to kind of focus on communities of color when this comes up, because we find that so many of our poison cases are children of color. So
yes, we do. We do.
To make an effort to reach out to Spanish language media, and so we were fortunate enough to get that hit, and they did a great job with what they produced and put online. And so point being, we get these we get applications in, kind of with a little bit of an influx at different times. I had one more thing to share, but I don't remember what it
was. Well, if you choose to, you're more than welcome to. I noticed Kim raised her hand and wanted to ask away. Kim, go for it.
Actually, Karlos, I was kind of clapping. I was trying to.
Oh, applaud. My apologies. I misunderstood the icon, the emoji. Yeah. No, thank you. Yeah. Thank you.
Say something smart?
Everything was smart.
It was about the Telemundo advertising influx. I'm hoping that because of the mailings they went out, I'm hoping we get an influx of new people.
Yeah. No? Yeah. Yes. Yes. Hopefully, yes. And also just word of mouth as well too. I know Nigel and I earlier this year we presented in a virtual town hall. And we were, and as well as other colleagues and what have you. So that was pretty cool. We had about, I think 40 people on there or what have you. And it's still, I'm sure, available to watch online, and just getting the information out there is really, really important. Even for people who say, well, I'm renting, why would I, I'm not the homeowner. Why would I know? Well, I always say, well, one day, you should know your rights, because there's tenant rights and there's so much information for tenants, right? It's not just for landlords and property owners, but also maybe one day you might want to purchase a home. Maybe you might want to rent out a home, and you never know if you come across this. Also, another point that you mentioned and is just the racial inequity in all of it as well too, and seeing different communities kind of struggle more with this particular topic and what have you, which that's a whole nother episode in itself, which I'm sure we'll cross that path at some point. Before we end this particular episode, does anyone have any parting words of wisdom or anything that they wanted to add to share with the public?
Well, I think it's critical that I don't omit the notion that this is a low-income program. This is a program for our low-income families in Springfield. The residents in the homes for those call them the households that would apply, they would need to be low-income households. And we do ask for some proof of income related to your bank statements, your taxes, and your income from either work or benefits otherwise. And so that's critical for me to mention. I could not, end the session without saying that. And the other thing that allows for eligibility, because our focus is so much on lead paint and poisoning with children, we make these funds available for families and households with children under the age of 6 years old. There is the possibility that grown adults can be poisoned with lead paint in one way or another. Yeah. Particularly if they're in an environment where there's lead dust in the air, that can be problematic for adults too. But this program is specifically designed for families with children under the age of 6. If you've got a child over the age of 6 and you have a lead poisoning issue, or you would just like to try to make your home lead safe for your own reasoning, there are funds available for that through a different program, through actually a different agency.
Okay.
Wayfinders is a nonprofit here in Springfield that does have funds. It actually is a callback. Earlier I said we wanted to get the lead out of the house. Wayfinders program for lead abatement is called Get the Lead Out. That's the name of the program that they've got there. And they've got funding without some of the restrictions that we have. It's still a low-income program, but maybe with a slightly higher ceiling on that. And then also, you're not required to have a child under the age of 6 at their homes. Wayfinders also has the capability of helping families outside of the city of Springfield. My work and my money is focused particularly on the city of Springfield. But Wayfinders can support you if you are outside of the city. And I believe the state of Massachusetts may have some other funds as well for surrounding communities. So those are important things not to leave out.
Perfect. Thank you so much.
And I also wanted to add that if people have any more questions or they want to look more into the Springfield Healthy Homes just the whole collaborative, they could go to our website, Springfield Healthy Homes.
Yes.
And to make sure to check that out.
So much information to be shared.
So much info, yeah.
Absolutely. And if anyone listening has any questions from the community health worker standpoint, you can certainly reach out to me at Reyes, Reyes, at start@squareone.org. I'd be more than happy to reach out and answer in any which way, shape, or fashion. I want to first of all, I want to say thank you to my two colleagues, co-hosts, and for sharing your information, and also taking the time out of your schedule to do this. We do hope that this reaches everyone in not only Western Massachusetts, but also Massachusetts in general. And again, knowledge is power. So if you're living in Texas listening to this, first of all, thank you. And we hope that you have learned something. With that said, we want to end this and just wish everyone well. And just please remember that there are resources out there. Lead poison is still a relevant topic today. And also don't forget that Lead Poison Prevention Week is October 24th through October 30th. So look out for more information on social media. And thank you so much for your time. Have a good day, everyone.